Competency 4, engage in practice-informed research and research-informed practice. With this competency, I looked at 3 articles that reflected working with the undocumented immigrant population. The first article that I looked at, Irregular Migrant Access to Care, Mapping Public Policy Rationales, looked at the viewpoints on policy pertaining to immigrants and their ability to have access to specialists and healthcare beyond community clinics. The main points that it kind of reflected were everyone is deserving of care regardless of status or blameworthiness, that there should be no discrimination on moving from place to place, and that governments are obliged to support rights of access to adequate health regardless of status or background. Some questions raised within this research and within communities were, is there a right to the highest level of care? Will it increase immigration flow? Are they entitled to health care, and does their contribution to society determine anything? So what these questions really reflect are whether or not this particular community is deserving or is in need of certain healthcare resources. Yes, there are community clinics that provide resources to healthcare, but they're very limited and they provide very not enough or sufficient treatments for certain medical conditions that lie within this community. And so whether or not they should be able to access higher levels of care. There's always push factors for immigration flow. So healthcare or access to healthcare is not really the main focus or the biggest push factor in immigration waves within countries. And a lot of the times these individuals have resided in these countries for long periods of time where they have established a community and a home and have contributed to society financially and economically. However, universally, access to healthcare is only given in emergent services. And regardless of all stances highlighting the injustice, process, and legality prevent services that can be provided to these communities or that are provided to these communities. And there's no definite solution at the end of the day, but with compromise and implementation of resources and training, healthcare professionals can provide ethical treatment and decision making. So what this article kind of reflected is that there is an overall awareness that needs to be brought to this issue. However, at the community level, with resources and educational material, social workers, helping professionals, medical professionals can help kind of advocate and help navigate the system alongside these individuals so that they have access and they have the ability to kind of move forward in a positive direction. The second article that I looked at was Undocumented Latino Immigrants in Multidisciplinary Settings. This one focused on the importance of behavioral health providers understanding and acknowledging the multiple facets of an undocumented individual's life in regard to proper diagnosis and treatment. Even though it focused on behavioral health providers, it really just wanted to highlight in general to any helping professional that understanding client systems can help provide appropriate treatments. It provided information based off of ethical standards and laws that play a role in the healthcare services provided to individuals who do not have citizenship status. And it emphasized a provider-patient relationship and how behavioral health professionals and social workers and anyone within the healthcare system can play a role as a facilitator. And they would be facilitating a relationship between client and helping professional by understanding their barriers, such as fear, lack of or inability to communicate through language, their lack of access, transportation, their understanding of the healthcare system, and whether or not education and resources are provided to help increase healthy helping processes. So having a facilitator, having an advocate for the client can further increase positive outcomes within the healthcare system, regardless of policy implementation. The third article that I looked at was comparison of the usage habits of healthcare systems of the immigrants and local residents. So this article looked at migrant waves' influence on financial and social safety and their impact on the healthcare system of a country. It specifically looked at comparing the usage of medical services between immigrant and local residents. And results showed that over the course of 4 years in a highly migrant populated area, migrants used emergency services and labor and delivery services at a higher rate than local residents. This reflected that immigrants have a lack of access to routine care, therefore preferring emergency services or enabling them to use emergency services because they don't have the ability to get routine care to prevention and screening of these medical conditions. It also reflected their lack of education or inability to kind of understand insurance systems and find the appropriate treatments that result in prescription and prescription costs, and effective, or what it looked at too and concluded was that effective and accessible primary health care was essential to this community, that being vaccination, general health care, psychosocial support, and language and communication barriers. So it looked at how the immigrant population differed navigating the healthcare system, the barriers that it placed on this community by comparing it to that of the local residents. And there was a significant difference between how these communities both access the resources available to them. And these are my sources.